got some increased pronation on that left ankle there too that we'll start working on. First visit for now.
I don't use a cane anymore.
This will be Mr. Randle's third visit with us here. He had two pretty much back to back on a Friday, Saturday about a month ago or so. The adjustment's gonna be fine. I'm wearing something in my back, so not to make you worry there. Big breath in. We'll do just 1 or 2 stretches first. These hips and legs kind of hang and drop into the table. Feel that stretch going down into that low back? Did you feel that all the way down?
Oh yeah. Oh yeah.
Easier than the first couple?
Oh, much different.
Good.
Still ringing though. Still ringing.
Yeah, it's still always intense. It's just not as painful as what a lot of people think. Those muscles kind of hang and drop. Boy, oh boy. That was like the old Rice Krispie commercials right there. Snap, crackle, pop. Yeah, let that muscle hang and drop there. There we go.
Wow.
1/4 of an inch short on the right. I think it was closer to about a 1/2 inch on that first visit when you were in here.
It's like a full inch. Yep. Like 3/4 to a full inch. Cause I can actually stick when I stand on my left. My right foot, like alone, my right foot won't touch.
It hangs there. What's up?
Should I do shorter out breath?
These you can do nice and deep. The ones that I do on the ring dinger, being a little bit shorter, are primarily for the rib and intercostal muscles. If people try doing really slow exhales, they'll keep these contracted, which won't allow movement to go through that thoracic spine there. So for these, with me not working on that thoracic spine here just yet, once we get to that area there, that's where you can do the quicker exhales again. Okay, 2 more. One more there. Kind of slipped a little bit on the belt. Did those feel a little bit deeper than the last time too?
Yeah.
So after these 4 or 5s, I want to give you that break again to work on the soft tissue muscle there. One more. So let the chest drop and sink there. One more. These muscles tried to contract a little bit on that one. Did you feel them?
Yeah.
Yeah.
It always makes me stop breathing when I'm
That's that sympathetic nervous system. It tries to go into a fight or flight response, and you can't fly away, so it tries to fight. This is when you can do that little bit of a quicker exhale, because those intercostal muscles, they'll stay contracted if you try to go in really slow, which can become a little bit tougher and not as deep.
Okay.
I slipped a little bit on that one. So you can go deep with the inhale. So same type of inhale. There you go. Then just quick with the exhale. Yeah. There it is. The shoulders drop and one more. Feel those muscles trying to balance right there at the end. Yeah, you might drop the arms down for these last 2. Just gonna relax those shoulder blade muscles. A little bit more. Those shoulders dropping. There it is, nice. So cool. He's exactly even now. Tell me what this feels like when I bring the legs up this time. The right still tries to go a little bit short, but not as short as it was when we started. And we still have to do the leg pull yet too, which is gonna help out there.
Yeah, that's the range of motion is just amazing.
It's night and day different, huh? So these adjustments are primarily focusing on restoring what's called the cervical lordosis, or the normal forward cervical curve. Very similar to the adjustments you see us doing in the lower back, when we're going through this lumbar lordosis, except these areas are a lot smaller, so we use a knife edge contact point. One more. Table drop just a little bit early on. There we go. I didn't know how important that last one there was with all those cervical drops that we just did. Until I got the chiropractic school and started studying so much and getting that forward head posture, it helps so much get that hand back up
that's
onto the
what.
shoulder.
Oh yeah.
A little bit more on that last one. Perfect mobility routines that I'm gonna want you to start working on too with some of those resistance bands. I shot it yesterday here in the office.
Oh, I did. Oh.
There's a little bit of overpronation on the left side of that ankle there too. So it could be that body compensating because this leg being a little bit longer. It might be overpronating so the other side can even get to the ground here. There we go. Go. And one more. There we go. There we go.
Wow.
Does it feel looser after those adjustments there?
Oh yeah.
Yeah, one more. There we go.
This is gonna be some.
Little sore. Still sleeping on that side?
Actually, last night I actually stayed on my back almost all night.
Good. That's one of the hardest habits to change, but it can have a huge impact on how patients wake
Getting
up.
the pillows right under your legs is a.
Big factor there. Is you feeling better? Didn't hurt me a bit.
That makes one of us.
Nice.
After that last one, I was forgetting to breathe.
Plus, if you've never had them adjusted, you don't know what it's going to feel like, and your body's kind of surprised by it. Especially with them being deep. People don't even realize how many joints they have in their feet. How important they are.
They feel so light now.
There we go. There we go. Was that tender when I was just moving it around through that position there?
No, I think I wasn't breathing yet. I was just so.
About the fishing now, huh?
Think about a fishing
Getting
on
those hook sets ready.
I was ready to set it.
There we go. Usually with those deeper adjustments, they're not as intense. They're still intense adjustments, but a lot of times when people hear deeper, they're thinking, oh my gosh, it's gonna get worse when I go back. But usually the symptoms are starting to die down and
It's less
we're
and
able
less,
to,
actually.
exactly, we're able to go a little bit deeper with the
The
adjustments.
pain is, I mean, it's less. Like the adjustments are like, well, pain-free. Like the first one takes your breath away.
I try to emphasize to people that a lot of the adjustments that are the most uncomfortable are usually the ones that we need the most anyway, because we're trying to reestablish motion in the areas that don't like going through that motion right now, and that creates that dysfunction and creates other habits and other problems along the way.
That's what I'm worried about most is the muscle memory.
We'll start, after we get patients feeling a lot better, that's when we start working on things around the muscles and the mobility to help keep you out of the office too.
You don't know how much I want to cry.
Get a little bit longer with the steps and keep that head up. Those feet know where they're going. There you go. Just,
There's no.
does it feel a little bit more symmetrical too? That left foot's not overpronating as much either.
Everything just feels like it's lining up.
Good.
You know what I mean? Like it just feels.
So again, that biggest thing after this.
I'm not
Yeah, kind of gimping
going like
along
this all the time, and I still feel the overcompensation somewhat.
Yeah.
But it's.
But
it's
making
so much
improvement,
smoother.
making improvements each time,
Yeah.
huh? Good.
I don't feel like I need to overcompensate.
And the biggest thing too for people to know is that Randle has been helping along with himself too. He's not just coming in here and then going back and doing nothing at home. He's helping himself out with all the homework and all the exercises and things that we give patients here in the office, because that's really what's going to help with the development and the improvement of all these things in the long term, is to help yourself out with the mobility and with the other routines that we kind of implement for patients.
I
And
want
making
everything
that-
to stay in line where it is.
Absolutely, and trying to get those mobility and exercise routines specific to the activities that the patient does as well. So I'm going to be showing Mr. Randle a core exercise to help work against anti-rotational stuff for oblique muscles, because he does a lot of work with an automatic brush that kind of twists him from side to side and exacerbates a lot of those lower back symptoms. So I'll look out for a video this week on those exercises, because they might be something that can help you out too. Any final comments to the YouTube crowd out there?
No, I'm just amazed at how it's quick. I
knew I wasn't gonna be a 1 or 2 visit. Like, I knew my pain was extreme.
Yeah, and you've been
But
doing
I
it
never
for a while,
thought that
too.
within a couple visits, I would be this much better.
Well, thank you so much for trusting along and doing your part as well with all the homework and all the assignments.
That's the main thing,
too.
yeah.
So thank you guys for following along, and we'll see you guys soon for your ring dinger.